A 43 years old woman had a recurrent episode of the breast infection. This is recurrent. She had received multiple courses of antibiotic and is troubled by persisting green nipple discharge. Clinical examination reveals green nipple discharge but no discrete lump. Imaging with mammography and ultrasonography is reassuring. It is U2M2. What is the best course of action? So a patient who is suffering from a recurrent attack of the breast infection, and also there is a greenish discharge but there is no definitive lump. So what may be our next step? Here the options are: undertake a Hatfield procedure, undertake microdurectomy, arrange breast MRI scan, express fluid for cytology, and prescribe danazole. So what may be the option? So first of all, here we can see this is a normal duct, this is a normal breast duct, and here we can see this is a dilated, and it is a dilated breast duct. So in case of dilated breast duct, what happened? Here we can see these are the breast duct. They are usually normal, but in this condition here we can see this is a dilated milk duct. So in case of dilated milk duct, what happens? There is milk and secretion, they are accumulated within this duct. So this point is very, very important, that in the dilated duct there is milk and other fluid, they are accumulated. And what they causes as there is a fluid present, so there is a chance of development of infection. So this type of condition, there is frequent infection and there is greenish discharge. So multiple duct pathology, and if this may be present in multiple duct also. This in this picture showing the single duct, but there may be involvement of the multiple duct. And in case of the multiple duct pathology, the go for the total duct excision. And when there is the single duct pathology, in this condition there is a microdurectomy. And the women is troublesome duct ectasia, that means this patient we are dealing with the duct ectasia, that means the dilatation of the duct. So dilatation of the milk duct. So in case of dilatation of the milk duct, there is development of the duct ectasia, and the treatment is the excision of the duct or removal of the duct. And this is the treatment, which is the total duct excision, that means the removal of the duct is the only solution for this condition. And when there is suspected multiple duct, this is total duct excision. When there is single duct, there is the microdurectomy. And here we can see this is the duct ectasia. The patient usually present with toothpaste like nipple discharge or greenish nipple discharge, or the color may be brown, may be green, may be muddy color, but most of them are the green color. So this point is very important. When there is the green color nipple discharge presence, so in this condition diagnosis go for the duct ectasia. And the clinical findings of the duct ectasia can mimic malignancy, that means there is frequent attack of infection, there is nipple discharge, sometimes may be blood. So in this condition there is a suspicion of the carcinoma. So screening for the carcinoma, that means the diagnostic tool of the carcinoma such as the ultrasonography and mammography should be done. And the ultrasonography it denotes more than 3 millimeter of the dilatation of the duct. So when the duct diameter is more than 3 millimeter, in this condition this is suggestive of the duct ectasia. So what we go for? We go for a Hatfield procedure, because there is a, as here is a recurrent episode of the infection, so there is a multiple duct ectasia present, and here is no discrete lump, that means there is no chance of the carcinoma.